Good afternoon. I am sure that most of you are as happy as I am that the governor reopened some of our businesses beginning on May 1st. More on that later. I'm sure there will also be many questions about his mandate to wear masks. We've been dealing with these questions since our neighbor implemented a similar mandate a couple of days ago. The reason we have not done so is because we question the legality of such an order. Remember, I said my first priority is to follow the Constitution. Now is the time we need the Constitution the most. It is not the time to throw it out the window. The governor also stated that he will not be asking the police to enforce this action. Additionally, Mayor Lightfoot said the Chicago police will not be enforcing this action. I am guessing that they have received the same legal advice that I have, that the legality of such an action is highly questionable, as is its enforceability. My position is that we should not pass illegal laws or mandates that we cannot enforce. With all of this said, the CDC recommends wearing a face covering in public if social distancing of more than 6 feet cannot be maintained. I strongly advise that people comply with this recommendation. It's for your safety. So ultimately, we're asking for voluntary compliance for this recommendation. Moving on to the reason for today's video, to introduce and explain our reopening plan for when the time comes. We finished this yesterday. Up until yesterday, the official guidance was the stay-at-home order was going to be lifted on April 30th. We were preparing responsibly to develop a plan that allowed us to reopen in a safe and measured way. Yesterday, the governor extended the stay-at-home order another month. We decided it is still appropriate to share this plan because people need to know what to expect in the future when we do start to reopen. Remember that failing to plan is planning to fail. With all of that said, this is a plan. As we said in the military, no plan survives contact with the enemy. In other words, we still need to adapt and adjust as we are given new information and directives from the state and federal government. We are prepared to do just that. Many of you will have concerns about us introducing this plan. Remember, it is simply a plan. We prepared it because until yesterday, April 30th was the last day of the stay-at-home order. We are sharing it because it helps businesses and residents know what to expect when reopening does occur. Also, another very pertinent phrase from my military days are the 7 Ps. I'll only use 6 of them today. Prior proper planning prevents poor performance. That's why we have this plan, and we're prepared to adapt it as necessary. Now, I would like to introduce the plan. So now I would like to talk to you about the Village of Orland Park's reopening plan. These recommendations and guidelines are developed using several sources and advisors, including the CDC, the National Institute of Allergy and Infectious Diseases. We use the White House, we use several working papers, country openings, state openings, local health professionals. We talked to several business leaders, including members of our own Chamber of Commerce. We talked to local municipalities. I really want to thank Mayor Mahoney from Palos Park and Mayor Fleischer from Mokina for providing input to this plan. The plan is intended to offer recommendations to the state on how to safely phase reopening and will be adjusted as necessary based on future state or federal guidance. This plan has received a lot of local feedback, like I've said, and while the modified stay-at-home order begins this phase reopening, as you'll see, there is much more that we think we can do. The state is encouraged to engage and communicate with us and other local municipalities, with businesses and its residents as the state's guidance is developed. The latest University of Washington model indicates that the state of Illinois' usage peaked on approximately April 17th. Projections indicate declining resource usage. Yesterday, the governor introduced new models that we have not yet seen or reviewed. In any case, resource usage seems to have peaked sometime between mid-April or expected to in the next week or two. Illinois is overwhelmed currently with unemployment requests, and revenue projections at the state and local levels are down significantly. Orland Park is projected to lose $2.7 million in sales tax this year, $473,000 in income tax, and a significant amount of motor fuel tax. The state of Illinois projects an over $2.2 billion revenue loss this year and $4.6 billion revenue loss in 2021. Reopening the economy using a measured and staged approach is not only safe, but it will help get people back to work, minimize the revenue losses in the state and at the municipal level, and help our society return to a sense of normalcy. We can do this safely with a measured approach. A phased approach can be used to keep people safe while reopening the economy. What we call phase 0, preliminary reopenings, as we'll discuss, the governor pretty much did with the May 1st order. And then there are 3 other phases of opening, and then there's a monitoring phase after this opens. All phases would be tracked, and several trends would be observed before moving on to the next phase. So some of the data that we would be tracking are COVID-19 cases by onset date and report date, hospitalizations by date, number of daily tests, percentage of positive tests, the ICU bed and ventilator usage and availability. Additionally, we can look at other data like tracking cases to ensure that they're not coming from any of the new businesses that we've opened. Trends to observe include a downward trajectory of COVID cases, a percentage of positive tests decreasing, hospitalizations decreasing, and ICU bed and ventilator due to COVID decreasing. The Village of Orland Park will make several efforts to support business reopening. These include marketing and advertising efforts, messaging efforts to encourage people to go out safely again, helping businesses source and find supplies. This is really critical, and we've actually already started this by ordering masks and surgical masks and hand sanitizer that businesses can get from us if they're having a tough time sourcing this. So that's very critical for businesses to be able to reopen safely, and something the village can provide, and we have already been working on for some time. Prepare written and/or video communication for the proper use of PPE. We can help the businesses develop written communication to aid their assessments for reopenings. We are offering to the state and to the county to make personnel available to help with contact tracing. We've heard that they don't have enough people. We're happy to do that. So far, they haven't taken us up on that. We encourage the use of serological testing as part of a strategy to assess immunity. This is a big deal to understand how many people are already immune. And in fact, beginning next week, the Village of Orland Park will be working with Payless Health using the Abbott serological test to assess its employees. So this is a first step in trying to understand how widespread this disease really is. We encourage the stand-up testing facilities for both the serological and active testing in the area. So we will continue to look to do that. Like I just said, the serological testing we are going to begin next week. We're going to communicate with residents, as we have been throughout this, at least a few times a week, about the current situation, what decisions we're considering, and clear guidance for adherence to the mitigation that we're doing. We will tailor our strategies as needed to address our community's needs. This is really critical, that we understand that this is simply a plan, and we will adapt and adjust as necessary. Individuals and employers will need to take actions for all phases. Individuals will need to continue to practice good hygiene, disinfect frequently used items, use the recommended procedures for regards to face coverings when in public, and most importantly, if you're sick, stay home. Employers need to develop and implement appropriate policies based on regulations, as well as industry best practices that include social distancing, temperature checks, disinfection, etc. They also need to monitor their workforce for symptoms, and they need to develop and implement policies and procedures for workforce contact tracing. The plan begins with what we call phase 0, preliminary openings. During this phase, businesses that are at low risk and are considered essential should be allowed to remain open. Open businesses would continue following social distancing and hygiene measures currently in place. The village could intervene to help businesses with critical supplies, and all other essential businesses and stay-at-home restrictions would stay in place, and social groups would be less than 10 people. The governor, in his announcement yesterday, pretty much followed this phase 0 starting on May 1st. Interestingly, you should know that on April 10th, myself and 4 other mayors sent the governor a letter requesting that businesses like these be open. While we haven't received a response back, apparently they listened to us, because everything that was in that letter was part of his May 1st openings. So we want to thank the governor for taking our thoughts into consideration and for implementing them, and that begins on May 1st. Examples you'll see in green: the bike shops, dog groomers, elective surgeries, golf courses, landscape nurseries, state parks. Those are things that that his plan is exactly like what we suggest. Those in yellow, the retail stores and retail competing with big box stores, we thought they could be open completely. He said they could be open for e-tail and pickup only. The reason we feel differently a little bit is because some of those mom and pops don't have e-commerce capability. Additionally, since we've been running so many people through Costco and Lowe's and Home Depot and Jewel and Mariano's, up to 2,000 to 3,000 people a day each, that we feel pretty comfortable that smaller retail stores could be open safely if done in the right way. Those that you see in green, elective surgeries are pretty critical. People are in pain. People's quality of life is going down. That will lead to other health issues. And since the healthcare industry is not being as taxed at the moment, they can actually start doing those surgeries. Golf course is an example where 40 other states have opened these up without an issue, so why not? It's a socially distanced sport, so it's something that, that could be done now safely. Phase 1 would be the next phase, which would occur as conditions based on data would allow. And I believe that's what we're going to do. I hope that that's what we're going to do here. With the governor has extended it till May 31st. I hope he's open to moving it earlier if the data shows that. If the data doesn't show that, then we will continue to follow the order and not open anything else up. Under this phase, most businesses would be allowed to reopen. Some businesses will become essential. I would probably agree with most of you that hair salons, barbershops, I certainly could use a haircut, are becoming essential. By this time, they will certainly be critical and essential. These openings would need to continue to follow social distancing and hygiene measures that are currently in place. The village can also intervene here to help businesses with their critical supplies. The types of businesses included here would be barbershops, beauty salons, nail salons, all offices, outdoor spaces except for playgrounds, religious services, restaurants, retail stores, both outdoor retail stores as well as our mall. Our mall has submitted a very detailed plan that makes me feel very comfortable with allowing them to open in this phase. Clearly, those with outdoor entrances would be allowed to open if again, all those big box stores can have all these people in it. Why can't other retail stores do that? Restaurants would be allowed to be open, but with only half of their normal seating capacity and other measures in place. All of these businesses would have to take certain measures, like recommended measures like surgical masks for their employees that are in contact with people, disinfecting, potentially hand sanitizer at the door. So there's measures that they would have to take to open up. Additionally, and this is really critical, all vulnerable people should continue to shelter in place, particularly the elderly and immunocompromised. You're going to need to monitor and care for yourself. We know that this disease is particularly hard on the elderly and immunocompromised. That is where the overwhelming majority, over 95% of all of the deaths are occurring. So it's very important that you care for yourselves. We need to maintain social distancing in public. We'll avoid socializing in groups more than 10 where possible. Non-essential travel should be minimized. We would still work from home wherever possible, return to work in phases. Employers should consider closing common areas if people are going to congregate there. They should also strongly consider special accommodations for personnel of their workforce that are vulnerable based on their either their age or their underlying health conditions. Schools and youth activities would remain closed. Large public venues would remain closed. No visitation would be allowed at special needs and or adult living facilities. Right now in suburban Cook County, 28% of the deaths come in those types of facilities. It's very, very important that people stay out of those facilities and don't bring this disease into there. We would move on to phase 2 at least 2 weeks later, and again when conditions allow. We would relax mask usage but keep social distancing. The types of businesses that would be able to be open, gyms and fitness facilities would be able to open in this phase. The golf course locker rooms would be able to be open, and if not open yet, the driving ranges could be open, fully open. Massage could be open. Movie theaters, nurseries and daycare centers, organized youth activities could resume, and outdoor events could also resume. And on the outdoor events, The outdoor events would still be kept less than 50 people. Non-essential travel can resume. All vulnerable people, again, the elderly and immunocompromised, should continue to shelter in place. You're going to notice this for a long time because these are the people that we're most concerned with if we start to see an increase in cases. Indoor gatherings of more than 50 people should be avoided. In public, individuals should maximize physical distance from others. Employees are encouraged to work from home again. Employers, again, should consider the common areas as well as special accommodations for those who in their workforce who are vulnerable. And still, no visitation to special needs and or senior care facilities. I cannot emphasize this enough. Those are very, very high areas of death, and they're very difficult to keep this from spreading. So it's important that we keep this out of those areas. Phase 3 would be a complete reopening of everything. So vulnerable populations can again resume public interaction, but they should probably still practice social distancing and avoid large gatherings of more than 50 people. All businesses would be open without restrictions, though you still consider social distancing where possible. Employers can resume unrestricted staffing at work. Visits to special needs and or senior care facilities and hospitals can resume, but we need to do so carefully. Large venues can be operated under limited physical distancing protocols, and gyms can be fully reopened. So the final phase is what I call the monitoring phase, which follows the full opening. We need to monitor cases and certainly contact trace cases into the foreseeable future. If there's increase in cases that warrant an increase in mitigation, the following approaches should be attempted in order with sufficient time to evaluate each step. So our first step would be go back to a social distancing strategy instead of shutting everything down. Immunocompromised and 60 and over would shelter in place. Work at home strategies could be implemented. Everyone else should use a 6-foot social distancing wherever possible. And we should make sure we're communicating everything that's going on to our residents. Then we should evaluate that. If that doesn't work, then we should look to reinstate the phases one by one as we continue to monitor. As opposed to going to an all-in approach right out of the beginning, we should do a phased approach of stepping back into some of these restrictions. In summary, at some point in the not too distant future, our economy will reopen. Governments, businesses, and individuals need to have a plan. As the pandemic develops and information improves, plans will need to adapt. In order to make adjustments, a plan must be in place. You can't adapt or adjust to nothing. So this is our plan. This is a starting point. Businesses need to understand what the government's plan is in order to prepare. This gives them something to prepare for. Testing and data needs to improve so we can make informed, data-driven, not assumption-driven, but data-driven decisions on the next steps. There's a lot of opportunity for this, not only with testing, with serological testing, but also with contact tracing. To our knowledge right now, there have been no cases traced back to our big box stores that are currently open. That suggests that retail can be open if it's opened in a smart way. We need to learn from that so that we make sure other retailers open in that way. And then we can get them open in a safe way. Also, things like golf courses, there's about 40 states that allow them, and there's been no clusters or cases traced back to those golf courses. So that can also be done safely. Same thing with state parks. Forest preserve bike trails, walking trails have been open for a month, and we've had no issues. There's no reason state parks can't be as well. So that's the type of data and information we need to leverage not only from the state of Illinois, but from other states so that we know how to safely reopen. We are hopeful that the state will engage the municipalities in these discussions about reopening, and we're going to be sending this to the state, and we're hopeful that they will take our opinions and thoughts under advisement as they develop their own plan. I want to thank you all very much for taking the time to listen to all of this today. It's important that you understand that we have a plan, but it is just that, it is a plan. It will be adapted and adjusted as necessary as we get more information from the state and the federal government, and more directive from both of those entities. We think that things can be opened if you use a measured and responsible approach, and we think that we've developed one here. We will adapt this as we discussed, as we need to, and when the time comes and we're ready to open, and the state says it's okay to open, we have a plan. We have a plan that we can implement that we think is safe and will keep people safe, but will also allow our economy to get back on its feet. I want to thank all of you very much for the efforts that you have made throughout this whole ordeal. It is your actions that have allowed us to keep the case level down, have allowed us to see improvement in the number of cases and lower the amount of resources that we've needed. So it's your efforts that have really made the difference. And you've done so without us giving the heavy hand of government to force you to do it. We've asked you to do it and you voluntarily complied. We've educated you and you voluntarily complied. We appreciate that. It speaks volumes for the people of Orland Park. I'm proud to be your mayor, and thank you very much for listening.